Hello, Mr. Lawler. Siobhan is my name. I'm a member of the team here today. Can I confirm your name and your date of birth, please?
Yeah, it's John Lawler and it's the 7th of June 1994.
Thank you. Would you prefer if I called you John or Mr. Lawler?
John's fine, thanks.
Thank you. John, we'd like to pass a nasogastric tube on you today. This is passing a tube into your stomach to assist with feeding. Have you had this performed before?
No, I haven't.
So what will happen is we will pass the tube through your nose to the back of your throat and into your stomach. We will ask you to swallow sips of water to help with the process. Do you have any questions on that?
Will this be painful?
It will be uncomfortable, but it shouldn't be painful. If you do need a break, you can put your hand up and we can pause the procedure. Do I have your consent for the procedure?
Yes.
Thank you. So we're going to measure the tube before we insert the tube. So we measure from the nostril to the earlobe and down to the zippy sternum. This gives us the length of the tube, and you can mark or note the number at which you arrive. We have our tape to tape the tube into position. We have our test strips, our lubricating gel, and we have our stopper, our spigot. We will also have our documentation for later putting in the chart, our 50 ml syringe, our gloves. And for this procedure, we will ask the patient to swallow once they feel the tube at the back of their throat. We can offer them sips of water through the straw. We'll rewash our hands and put on our gloves. So our patient is in an upright position, making sure that they're comfortable. Check the nasal passages to make sure that they're clear. We're going to lubricate the tip of the tube using a water-based lubricant. So lubricate 2 to 4 centimeters. We'll take the water to the patient and then they can drink as soon as they feel the tube at the back of their throat. So the tube is placed horizontally through the nostril, making sure to stay on the floor of the nostril until it hits the back of the throat, and then we're going to instruct the patient to swallow when they feel the tube at the back of their throat. At this point, we can encourage them to swallow or take sips of water as they're allowed. We will then tape the tube in place. So the tape is anchored on the top of the nose and also taped around the tube itself. So we're securing the tape on the nose and on the tubing. So that is insertion of the tube. Once we have inserted the tube to the mark that we noted, we're going to check that the tube is in place. And to do this, we have 2 methods. Number 1, we're going to take a specimen from the stomach via the tube, and then we will X-ray. So firstly, we will take our test strip and we're looking for acid in the stomach. So we have 2 ports here. We have the guide wire and also the port here that we're going to remove the specimen from. So we insert the syringe into the port and then we draw back, looking for content. And close off the tubing. place the specimen onto your test strip. We're going to measure against the pH test strip. To complete the procedure, we will thank the patient, making sure that they're comfortable. We will discard our equipment appropriately, wash our hands, and document the procedure in the patient's notes.